Today is National Prescription Drug Take-Back Day across the country, which aims to prevent drug addiction and overdose deaths. Last year's events in April and October collected a combined total of nearly 1 million tons of prescription drugs. According to the 2018 National Survey on Drug Use and Health, 9.9 million Americans misused controlled prescription drugs, mainly obtained from family and friends. Here now to talk to us about Prescription Drug Take-Back Day is Dr. Jonah Stolberg. Dr. Stolberg is a general surgeon and health services researcher at Northwestern Memorial Hospital. He's also an assistant professor of surgery at Northwestern University's medical school. He has an MD, a PhD in health services research, and a master's degree in public health, all from Case Western University. So, Dr. Stolberg, thank you very much for joining us tonight.
Thank you for having me on.
So we know the pandemic has taken its toll on Americans when it comes to mental health and substance abuse. People are isolated, obviously. They're having trouble getting treatment. So what have you been seeing just in your personal experience over the last 8 months?
Yeah, we've clearly seen a rise in overdose deaths in the last 8 months, not only here in Chicago, but across the country, and we're quite concerned about it.
So Purdue Pharma just settled a lawsuit for more than $8 billion over its marketing and distribution of OxyContin, which the government says helped fuel the opioid crisis. Do you think this decision will change anything regarding the opioid crisis?
Well, I can only hope so. I mean, a lot of those funds will be funneled into resources to help patients, resources to help hospitals, and help us combat the ongoing crisis that we're dealing with. And so we can hope that those funds are spent well and that people get the support and help that they need.
Okay, so let's talk about National Drug Take-Back Day itself. What should the average person know about the medicine in their cabinet?
Well, they should know that all expired medication is bad for them, and it's bad for their loved ones, their pets, and others that are around. So anything that's expired should be disposed of appropriately. But things that are not yet expired but are dangerous, and in particular, opioid medications fall very high on that list, really should be disposed of as soon as you're done using it. And what they should know is that the main driver of non-medical use, as you said at the top of this segment, really is this process of diversion, meaning that individuals who are abusing medications will borrow them from friends and family or get them from your cabinets while you're away. And so medications that you're no longer using that can be harmful to you and your family really should be disposed of as soon as you're done with them.
Okay, so what are the risks of just throwing the drugs in the garbage or flushing them down the toilet? Why should people go to the effort to participate in one of these drug take-back events?
Yeah, that's an excellent question. So medications can be harmful to our environment, and in particular, when they're flushed, they have multiple downstream effects that can get into our water system and cause other problems. We've even had incidences where individuals know that households will be throwing away opioids and people will go through their trash and steal them. And so really they can be harmful to the environment. They can be harmful to those who are looking for them, looking to steal them. And the best way to dispose of them is to return them to a year-round disposal site, either at police stations, hospitals, or pharmacies, or to participate in a drug take-back day like the ones we are hosting today.
All right, Dr. Jonah Stolberg, thank you very much for joining us tonight.
Thank you for having me.